the need for telehealth. Telehealth is not a new concept. It's been out there for a while. As you know, we started using computers and digital technology in order to record patient data. The next step was to see if we can conduct visits, but it really didn't pick up as much. I mean, the rural health problem has been there, and we thought about that, but the pandemic really brought home the idea that we could conduct a mass amount of medical visits through the technology. You know, it wasn't just a benefit for a high-end EMR practice to use telehealth or a hospital, but it now became a way to cut down the risk of people infecting each other through COVID-19, just because of the, as you know, the variety of the spectrum of where people could be asymptomatic or have mild symptoms and still be infected. Of course, I talked about the rural health. Mental health is also an area that has been revolutionized by telehealth, and you know, that's an area that has historically been underserved in almost every state in the country, everywhere, every jurisdiction. Mental health services are less than need be because of the large amount of mental health patients. And then, of course, people with physical limitations, transportation issues comes to mind, the diabetic who has walking problems, the elderly, the overweight, people who are bedbound for strokes, etc. And then it's another revenue stream for providers because, as you all know, if you've been in healthcare for any bit of time, it's gone from a, you know, procedural reimbursement system. You do more procedures, you get paid, to now a pay for performance with all of the measures that in the last decade have come out to NCQA and other organizations and insurance companies and government agencies have adopted that. So I think it's just now that we'll talk about later about some legislation that has been enacted to help even Medicare reimbursement for telehealth and other payers, private payers, of course, are paying for it. So this is really a good revenue stream, especially since now the procedural and the volume is not such a big payment model.
For more information, click on the link below or visit databrackets.com.